Intense swelling behind your heel can be Achilles tendon bursitis. You may notice a red lump, painful and warm behind your heel. It is hard to wear your regular footwear. This might be bursitis. Bursa are cushions that we have in many parts of our bodies. They exist to absorb the friction between tendons or between muscles and bones and ligaments. When this bursa becomes inflamed, it can get bigger and more painful. Today, I will explain what causes Achilles tendon bursitis and how you can get rid of it. So let's talk about Achilles bursitis today. Before I continue, let me remind you that this video is intended for educational purposes only. It is not medical advice. If you have a condition that is causing your pain, please talk to your doctor. In case of emergency, go to the nearest emergency department or call an ambulance. The Achilles tendon is the strongest and largest tendon in the body. It is this thick structure we have on the back of our heels. It connects the muscles in the back of the leg to the calcaneus bone in the foot. This tendon is very powerful. When a person jumps, this tendon pushes the foot down and the whole body up. There is a bursa between the Achilles tendon and the bone. This cushion protects the tendon from rubbing against the bone, as this could cause some damage to the tendon and ruptured it. However, there are situations that the bursa gets inflamed. Inflammation means four things: red, hot, swollen, and painful. What causes Achilles bursitis? The start can be acute, sudden, or gradual and chronic. An acute start usually means there is an injury, a trauma, or it could be a gout attack. Check my other video about gout. Chronic bursitis is not so evident. It grows slowly and the lump is not very visible. The person may have bursitis, but the only symptom is the pain. In this case, we order an ultrasound and the machine can detect that the bursa is inflamed and swollen. How do we treat bursitis? Fortunately, the bursa is very close to the skin, so we can apply ice and topical creams that contain anti-inflammatory drugs, and this usually resolves the problem. For a few weeks, we need to avoid too much ankle movement, like bending up and down. The person may walk normally, but avoid jumping. Sometimes we recommend a night splint to keep the ankle in a neutral position. But when the person wakes up in the morning, the foot is usually stiff, and we recommend them to do range of motion exercises. The ankle movements include moving up and down and side to side. So the person will need to do at least 5 minutes of range of motion exercises in the morning while they are still in bed, after they remove the splint. Sometimes we recommend a heel lift, a few centimeters, just to alleviate the pressure behind the heel. If the person still has symptoms after they tried these strategies, then we might need to do a steroid injection to reduce the inflammation. There are also some treatments with laser or extracorporeal shortwave therapy. Some antibiotics increase the risk of Achilles tendinitis and rupture of this tendon. So if you are taking ciprofloxacin, delafloxacin, or gemifloxacin, please talk to your doctor. And if you have gout, it might be that the bursitis and tendinitis are related to gout. So you need to talk to your doctor about that. If you know someone with Achilles tendon bursitis, send this video to them. There is a share button below this video that you can use. And don't forget to send your comment. Let me know what you like about this video. Thank you for watching. Goodbye.